Today on the She Found Health Motherhood podcast, I'm chatting all things pelvic physio with Krista Wark. She's going to tell us her top 5 pelvic physiotherapy tips and answer a few questions that were submitted by our community members. Krista Wark is a physiotherapist with a practiced interest area of pelvic health. She is the owner of Karen Physiotherapy, a fully virtual clinic that offers physiotherapy over secure video call. She launched Karen Physiotherapy when she recognized that her pelvic clients were often those that had more barriers to accessing care in clinic. This is for a number of reasons, including lack of trained pelvic physiotherapists in their area, lack of childcare, concerns about stigma, etc. Krista is passionate about helping all humans with their pelvic health. She helps all ages and genders with bladder, bowel, sexual, and core functions. She also helps people navigate pregnancy, labor and delivery, postpartum, and beyond. She is passionate about educating as many people as possible about their pelvic floor muscles and pelvic health. If you're pregnant or newly parenting and finding your usual supports are lacking during these unprecedented times, then you may be interested in our membership group, the Pregnancy Posse. The Pregnancy Posse is a safe space for pregnant people and newly parenting people to come together and learn about pregnancy, labor and delivery, and the early postpartum period, supported by experts in the field. For more information, visit our website and check it out under products. Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
So excited to have you on the podcast today. Let's just dive right in. I'm super excited to hear your top 5 tips, as I'm sure our listeners are. So let's get started.
Yeah, absolutely. Thank you so much for having me. I'm super excited to be here.
Awesome.
I love talking about pelvic health, as you know, so I might just get going here.
Perfect.
So I put together 5 of my tips for during pregnancy from the pelvic physiotherapist perspective. Obviously, there's more than that, but we've got 5 major ones. So one question I get a lot is, when do you start seeing a pelvic floor physiotherapist during pregnancy? And the ideal that I like clinically is to see someone 3 times during their pregnancy if there's no issues going on. So there's no pain, there's no incontinence, nothing that they need actual active treatment for. So usually sometime in the first trimester, usually near the end of the first trimester, I like to teach people how to use their pelvic floor properly, educate them on proper exercise during pregnancy, and then we'll touch base halfway through. And then a really important one is 1 month before labor and delivery. And that's where I go over all my muscular insight into how to move the pelvic floor with labor and delivery, different positions that you can use if you're feeling different types of pain. I always use some breathing and movement of pelvic floor. And if you're somewhere in your pregnancy right now and you're listening and you're worried that you didn't see someone 2 months into your pregnancy, don't worry.
Awesome. Because I did not even think of, seeing a pelvic floor physio to help you learn how to use those pelvic floor muscles, which can be really tricky. And I wonder if you think women who have an epidural, like having gone to pelvic floor physio, would be beneficial, because a lot of the time they're not really sure how to engage those muscles and how to start to push.
Exactly. And there's not a lot of research on that yet, but it's my clinical impression that if we've practiced for several months leading up to labor and delivery, there's going to be some sort of muscle memory there.
For sure.
Even if you have an epidural and you can't quite tell what's happening, there should be a little bit of that muscle memory. Yeah.
Yeah, that makes total sense. Okay, awesome. Tip number 1, if able to, have at least 3 visits.
Yes.
That's great. Awesome.
Yes. Tip number 2 is to stay active during pregnancy. So this is more general exercise. And everyone's general exercise is going to look different, and your body might start to tell you that a certain type of exercise doesn't feel great anymore at some point in your pregnancy, and it's really great to listen to that. But exercise in general can, well, we all know the benefits of exercise in general: better heart health, lung health, muscle health, mental health. But then specifically during pregnancy, it decreases your risk of developing lower back pain or pelvic pain. It also decreases your risk of urinary incontinence. So that's not even Kegels,
What?
that's just exercise in general.
Wow, I did not know that.
And then also it can decrease your risk of requiring a C-section during labor and delivery.
Yeah, I knew that. And I think it also helps prevent maternal exhaustion, right? Because your body's used
Right.
to, yeah. Oh, I love that tip. Yes.
So a physiotherapist can help you know what exercise is going to be best for you, especially if there's anything extra going on, like you have pelvic pain or you already have urinary incontinence. So you're not quite sure, should you run? Is that going to make you leak more? That's where a pelvic physiotherapist can really help guide you so you can stay active and not just stop completely because you're worried. And hopefully keep all your general health up as well.
Yes. Awesome. So tip number 2, stay active. And I love that because that is so important for general health and general pregnancy health. Yay. Awesome. What's next?
So, tip number 3 is about your abdominal muscles. So, if you've ever heard of diastasis rectus abdominis as a
Oh, so
listener,
many people ask me about this.
so
Yeah.
many people ask about it. It's when the rectus abdominis muscle, so it's that six pack muscle, the abs that run from your rib cage down to your pubic bone, they will separate as your abdomen gets bigger. And just a little fun fact, it doesn't only happen in pregnancy, it can happen for other reasons as well. But it's really, really common in pregnancy. And there's even new research studies out to say that it happens to everyone at some point during pregnancy, even if it's just minor. I don't know if that's the strongest study, but I've heard this recently. So how can you prevent it? So there's certain factors that are out of your control. So even if you do everything the way you're supposed to, you still could get the separation. However, there are some factors that are in your control. So trying to not put too much stress through your abdominals when you really start to show. So when we know that your abdomen is starting to protrude, that's when those muscles are getting stretched out. So things that would be putting extra stress on those muscles would be like sit-ups, crunches, V-sits, planks, sitting or going from lying flat on your back to sitting straight up. Even that just functional movement can be really challenging on those muscles. And the bigger you get, the more you're potentially straining those muscles. So a sign to watch for is if you go to sit up out of bed and you look down at your abdomen, you might see a coning or a bulging above your belly button, and it looks like your tissue is actually coning.
Yeah.
If you see that, then you know, okay, there's some sort of separation happening there. Not to worry, I'm just going to not do the sit-ups anymore. I'm going to roll onto my side and then sit up. That way you're not putting strain through those muscles. And then one other addition to that tip is that postpartum, the best way to address a diastasis, if you did get one during pregnancy, is to work with a pelvic physiotherapist who will help guide you on the proper steps for exercise.
Yeah, I get a lot of people asking me about that, and I tell them do pelvic physio because I know the
Yeah.
pelvic floor from you. Working with you is really intertwined, interconnected with the abdomen. And it's really funny you say that because I think I probably had a mild diastasis, but that's how I got out of bed when I was pregnant because I just hated that feeling, that sensation of the core.
Yeah.
So,
Yeah, definitely.
a little side question. I
Mhm.
do have people asking me what are safe core strengthening exercises to do in pregnancy? Because a lot of women still do want to maintain some strength in their core. And do you have any little tips there?
Yeah, that's a great question. So it is really good to keep strong in your core, as you know, to probably
Mhm,
help prepare for labor and delivery.
mhm.
So there are lots of different exercises that would be comfortable until it's no longer comfortable to lie on your back. So things like glute bridges, activating your transversus abdominis, which is your deeper core. Some people imagine it like a corset that wraps around your abdomen. So doing those activations, lifting opposite legs, even things like dead bugs can be
Yeah,
good at the beginning. Bird dogs, that's when you're on your hands and knees and you're lifting opposite
yeah.
arm and leg. And then general core strengthening would be things more like if you're doing single leg deadlifts or you're doing squats or lunges, you're still using your core at the same time, and even some upper body weightlifting.
Mhm.
But I would say it is a little bit variable depending on the person.
So that's
So
something that a pelvic floor physio could help guide
absolutely,
people with.
because you might do bird dogs, for example, but you might not be activating the right muscles, and
Right.
then you might actually be putting strain where we don't want it. So it is good to have a little bit of that feedback.
Oh, excellent. Awesome. Okay, sorry, I got you a bit off track.
That's okay.
But tip number 3 was all about diastasis recti and recognizing it, and adjusting your movement appropriately.
You got
Awesome.
it.
Okay, what's 4?
And tip number 4 is when to know when you need help from a pelvic floor physiotherapist during pregnancy.
Mhm.
So, signs and symptoms. One is incontinence. So, you're leaking bladder or you're leaking urine or bowel. Go see a pelvic physiotherapist right away because there is a very strong chance we could get on top of that and not have you experience it. Pelvic pain. So I'll often see clients who have fire crotch, which I think is a diagnosis that they would receive from their physician, right?
Mhm. Mhm.
Yeah. And there's often something that we can do. I'm not saying that it can fully go away per se, but there's usually some sort of muscular component
Mm.
where if we optimize how you're using your abs, how you're using your pelvic floor, those symptoms might actually decrease or go away. So that would be the same with groin pain, abdominal pain, lower back pain,
Mhm.
SI joint pain, any of that. If we optimize your muscles, it could help.
Mhm.
Any sort of constipation, or if you start developing hemorrhoids, learning how to relax your pelvic floor from a physiotherapist could be
Ooh,
really helpful.
yes.
And then we already mentioned the abdominal coning. So if you're
Mhm.
seeing the abdominal coning and you think you might have DRA and you're not quite sure what you should and shouldn't be doing, a pelvic physiotherapist can help.
Oh, that's super helpful. So incontinence or losing urine or stool, any type of pelvic pain, hemorrhoids, amazing. I never thought of that, and constipation, because that is a huge problem for women.
Huge.
Yeah. And diastasis.
Mhm.
Yeah. Awesome. Great tips. Good for
Yes.
providers to know too,
Oh,
when to
absolutely.
recommend and when to refer. Yeah.
Yeah, for sure, because there is more within the scope of the pelvic physiotherapist than I think I even realized when I went into it.
Oh yeah, totally.
It's
Well,
like,
like, and you have been
oh,
helping me with my hamstrings because the hamstring
right.
incision is so close to where all the pelvic floor muscles insert, right? So,
Exactly. So
yeah,
sometimes you might not even know that there's a pelvic floor component in your own
totally.
body. You're like, oh, it's a hamstring or oh, it's my hip flexor, but
Yeah.
it could have a pelvic floor component. Okay, so number 5
Yes.
is the most important pelvic floor exercise leading up to labor and delivery.
Mm,
And that is pelvic floor elongation and opening.
mm,
So the pelvic floor can move up and it can move down. So upward motion would be up in towards your head, and downward motion would be away from your head, moving towards your feet. And that downward motion also opens up the pelvic floor. So the pelvic floor muscles attach on the inside of your pelvis from your pubic bone to your tailbone and then out to your sit bones. So they're the muscles that fill that birth canal, the
mm-hmm,
exit of the babe when you're delivering. And as the pelvic floor muscles move downwards, they also open up. So they actually create more space for baby to come through. So the most important exercise I teach any of my pregnant clients is how to move those muscles down and open them to create that space. So we start practicing that really early in pregnancy. And this ties back to your question earlier, where we're thinking about, well, muscle memory. So even if you have an epidural, still that muscle memory is there because you've practiced it so many times leading up to labor and delivery.
Yeah. Oh, that is awesome. I mean, I think in general, we probably need to do a better job of engaging and understanding our pelvic floor, but definitely in pregnancy. That is an important
Absolutely.
time.
Yeah.
Awesome. Okay. So those were your top 5 tips. Very much appreciated. And then, as you know, we had a few people from our community submit some questions. And are you okay if I go ahead and ask some of them?
Yeah, let's do
Okay.
it. I'm excited.
Awesome. So, one of the first questions we got was, when is it safe to start exercising after a C-section?
Yeah, so this is a tricky one. I actually went and did even more research before the podcast just to
Oh,
make sure I
thank
was
you.
up to date because it is extremely variable. And I know most people don't like to hear that answer, but it does depend on a lot of factors. It
Yeah.
depends on how active you were before labor
Mhm.
and delivery. It depends on how the C-section went. It depends on so many things. But what research has shown is that you regain your tensile strength. So, for those of you that don't know what that means in terms of tissue, you regain the strength in your tissue's ability to accommodate against stretch. So, if you were to lift something heavy and you're increasing abdominal pressure, it's your tissue's ability to hold against that. So, basically, to stay strong against
Mhm.
force, which exercise is force.
Mhm.
So, at about 2 months post C section, you have about 50% of your tensile strength. At 4 months, 75%, and at 5 months, 90%. So that doesn't necessarily dictate exactly what you can do exercise wise, but it's good to keep that in mind that you shouldn't be going back to 100% of your pre delivery exercise before 5 months at the least.
Mhm.
Plus, there's going to be a lot of factors that you're going to be needing to talk to your other care providers about, not just the muscular.
Mhm.
So it's a very complex question, but I would say everything in moderation after, I mean, really any type of surgery,
Mhm.
and letting your symptoms, your pain be your guide on how much, if you're overdoing it,
Mhm.
and also your care providers. So a lot of people don't realize that, or it makes sense to me. You think, oh, I had a C-section, I didn't have a vaginal birth, I don't need to do pelvic floor physio afterwards.
Mhm.
But the truth is, you should, because you still had changes in your pelvic floor muscles because of pregnancy.
Mhm.
May have labored for a bit, so you might have changes because of that. And because the surgery is so close to your pelvis, the surgical site and the swelling and pain, all of that itself
Mhm.
can impact your pelvic floor as well.
Mhm.
So, and pelvic floor therapists are also, we are trained in treating your abdomen. So,
Yeah.
the best thing to do is to have a pelvic floor physiotherapist involved in your postpartum care. And we can assess for things like how well you're holding your core against a cough, how well you're able to hold your core against lifting 5 pound, 10 pound weight, and let you know what's safe for you right then, and then help you get to the goals that you want to get to. So I think this person in particular was thinking about mountain biking.
Yeah. Yeah.
And so, okay, well, we probably wouldn't start you mountain biking 2 months postpartum,
Yeah.
but I might go, okay, let's get you on a more upright bicycle and do some spinning and see how you feel, and let these symptoms be a guide, and then slowly progress
Yeah.
yourself back into it. I don't know if you would agree with that, Sarah.
Oh, I totally would. And
Mhm.
something else I often tell my my pregnant patients when they're, wanting to lose weight and get back to their sort of pre-pregnant state is, I always say, you need to remember it took you 10 months to get here, right? So you need to be kind to yourself and your body as you return to your pre-pregnant state.
Yeah.
So I think exactly what you said is in line with what I would recommend. And I
Mhm.
always tell people, like, go for a walk around the block. And if it feels fine, then tomorrow night do 2 blocks, right? And it's just totally let your body be your guide. So It's
That's
exactly
exactly
what we would
it.
say.
Yeah. I say that all the time too.
Yeah.
I say it took you that long to grow the baby. Of course it's going to take
Totally.
at least that amount of time to recover, and your life has changed and in a lot of ways
Yes.
too.
Oh,
Yeah.
yes. Yeah. Awesome. Okay. Another question we got, someone was asking, what are symptoms of a pelvic floor being too tight? And this person said, I feel like I clench all day. And this
Yeah.
was me before I met Krista.
Super common. Clenching and having too tight of a pelvic floor is super common. So just so you know that you're definitely not alone.
Yeah.
If you're listening to this out there, it's really common. And it is, I think, one of the reasons why pelvic floor physiotherapy is a subsection of physiotherapy, because we were just giving people Kegels. And if your pelvic floor is too tight and we're saying do Kegels, which are pelvic floor contractions, it's probably going to make things worse. So common signs of this, and it's not black and white, but common signs would be stress urinary incontinence, so leakage with cough or sneeze, pelvic pain, pain with intercourse. So if penetration is part of someone's sexual activity, pain with shallow or deep, changes in sensation of the skin. So there's a nerve that supplies the perineum, so the genitals. And if pelvic floor muscles are tight, they can put pressure on that nerve, which can change the sensations of that skin. So you might not have as much sensation. So you might not feel as much, or you could have nerve type discomfort, like burning, itchiness, something like that. And then constipation, hemorrhoids, anal fissures, those are also signs of a tight pelvic floor, but more in that back area of the pelvic floor. Oh, and tailbone pain.
Interesting. I did not know that. So I think what I would say, I totally agree, and is if anyone's having those symptoms, talk to your care provider. And I also think it's important for people to know that you don't actually need to see a physician to get a referral to a pelvic floor physio.
Right.
Sometimes people need it for their health benefits, but if you are having some of these symptoms and you're like, I want to see a pelvic physio, you can contact them yourself, right?
Yeah, you can contact us directly.
Yeah. And we're always, as
Absolutely.
physicians, we're always happy to see our patients to have these discussions and make sure that there's nothing else contributing. But if they, in and of themselves, think pelvic physio would be for them, totally go out. And I know most physios, yourself included, if you think there's something else going on, you will say, go back and see your doctor.
Yeah, I was just going to say that you can count on us sending you to your
Yes.
doctor if we think it's warranted, or if it's something that's outside of what we think is just muscle issue.
Yeah.
Absolutely.
Awesome. Another question we got, does perineum massage during pregnancy reduce the chance of tearing?
Yes, it can.
Yeah, I just did a post on this today, actually. That's so funny.
And that's one thing that I go over in my appointments with pregnant clients, is how to massage with the muscles in mind as well.
Oh, that's great. Yeah. So that is an especially good tip for first-time moms. So, or women, or people who haven't had a vaginal delivery before. So that would be a great reason to see a pelvic physio during pregnancy.
Yes.
Another question, at what stage of pregnancy should you start working with a pelvic floor physio? And I think we covered that in your tips. So ideally once per trimester if possible, and definitely a month before your due date.
And I just want to emphasize that it's never too late to start.
Yes.
So if you've missed that timeline, don't worry. It's never too late. So
Awesome.
find a pelvic physio.
Totally. Totally. And guys, I've had 3 vaginal deliveries. One of them was forceps, and I didn't go see pelvic floor physio until, I don't know, I was like a year postpartum for my 3rd baby, and I've had huge benefits, right? So it is never too late.
It's never too late. I mean, I see people 20 years postpartum, and we can still make improvements.
No, that's so awesome. It's so important. And I think I'm actually really excited that this is becoming such a like a well-known area of physio, because I think unfortunately women's health and pelvic health has sort of taken a back burner. So it's
Absolutely.
exciting that it's becoming more mainstream.
I know, it's so exciting. I love when clients find me and they say, "Oh, I learned about this on a Facebook group or social media." It just makes me so excited
Oh, it's
because
great.
one of the common things that someone will tell me in a session, in an initial appointment, is, "I wish I heard about this sooner."
Totally, right? That's
Hmm.
exciting. Okay, a couple
Yes.
more questions.
Yep.
How soon after delivery can you start pelvic physio?
The range of time is 4 to 8 weeks, and it totally depends on how you feel. If you feel ready, are you still bleeding? How was your birth? Lots of different factors, but 4 to 8 weeks is the ideal window.
Question I got, and I think we kind of covered this, is if you could speak to differences with pelvic floor issues in women who've had a vaginal birth versus a cesarean section.
Absolutely. There, again, a generalization because everyone's a bit unique, but I'll often see really tight pelvic floor after a cesarean section.
Mm.
The pelvic floor tends to tighten if there's
Mm-hmm.
been pain, surgery, because it's that protective response
Mm-hmm.
is to tighten.
Mm-hmm. Mm-hmm.
And of course, after a vaginal delivery, there's a lot of stretching that happens to the muscles.
Mm-hmm.
So, depending on how long postpartum, the muscles may still be quite stretched, or
Mm-hmm.
they might have, again, tightened up in order to protect.
Mm-hmm.
So, I very rarely would see a weak pelvic floor post C section, but I would more likely see a weak pelvic floor after a vaginal delivery and or a bit of tightness mixed in. It's usually a little bit more of a mixture depending on how baby came out and if there was tearing, if there
Yeah.
was an episiotomy.
So I think the bottom line is, regardless of the type of delivery, um, your pelvic floor can use some rehabilitation.
Exactly. And it might look completely different, but absolutely.
Yeah,
You could use some, I mean, you just grew a baby.
totally.
Regardless of how
Totally.
baby came out, you're going to
Totally. You
need some
carried it,
rehabilitation.
right?
Yeah. Like
And
that's huge.
okay. Can pelvic floor dysfunction affect IBS?
Yes, it can.
Oh,
Yes,
interesting.
which I was very surprised by when I did my courses. But yes, so pelvic floor dysfunction, whether it's too tight, too weak, can impact how well you can pass your bowel movement. So, a prime example is if you are constipated because your pelvic floor is too tight and your bowel movement is sitting in your rectum too long, what can happen
Ah,
is bowel, more watery bowel, can actually leak past the
yeah,
dry bowel,
yeah.
creating more of a watery stool or quote unquote diarrhea. And then you might pass the hard bowel movement later. So pelvic floor dysfunction can look like irritable bowel symptoms. It might not be that the actual bowel itself is impacted by the pelvic floor, but pelvic floor muscle dysfunction can mimic the same fluctuation between diarrhea,
Hmm.
constipation, or tending to have diarrhea more than constipation or vice versa can absolutely be impacted by the pelvic floor.
Oh, interesting. Yeah, that's good to know as a family physician
Hmm.
because, we see people with bowel complaints all the time, and I
Hmm.
honestly don't think of the pelvic floor.
Yeah, it's the exit, right?
Yeah,
So you just
totally.
think, oh, once it gets there, like it's just going to leave. But I have seen huge improvements in my clients who never had a normal bowel movement for 20, 30 years. And then I I educate them on proper bowel health, but I also work on the pelvic floor and huge dramatic improvements.
Oh, that's so cool.
Very neat. Yeah.
Very
Oh,
good.
another one of my hot tips is get a
Yeah.
squatty potty.
Ooh, what's that?
Squatty Potty is like the brand name, but it's
Yeah.
just literally a little footstool that you put your feet on when you sit on the toilet. And
Oh,
that way you're in more of like a squat, a deep squat position.
yes.
And that's actually better for the pelvic floor. It lets one of the pelvic floor muscles loosen off of the bowel so your bowel movement can slide out more easily. So you won't strain as often, and
Hmm.
straining can lead to pelvic organ prolapse. So it's really healthy. Everyone should use a squatty potty or
Awesome.
something. You don't need the name brand one, but
But a
something
footstool to
to
raise
get
your.
your feet up. Yeah.
Oh, interesting. Oh, I love that little hot tip to end things off.
Yeah. The only
Awesome.
reason you shouldn't is if it like hurts if you have a
Yeah.
back pain or something and it hurts. But yeah, if you
Yeah.
can use it, do it.
Oh, that's a great tip. Yeah, whether you're pregnant or not, right?
Oh, yeah.
Yeah, very cool. Okay. Well, thank you so much, Krista, for
You're
your awesome
welcome.
tips and answering those questions. Um, I look forward to future endeavors with you.
Likewise.
And guys, if you don't already follow Krista, she is on Instagram. Krista, can you tell us your handle?
Yes, I'm at Cairn Physiotherapy. So CAIRN Physiotherapy.
Awesome. And she does virtual physio, and I can attest that I have done it, and it is exceptionally convenient and beneficial. Awesome. Okay, well, take care of your pelvic floors, everyone, and thank you for listening.
Thanks, everyone.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.